This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Welcome, everybody, to Yeah, We're Going There with Dr. Natalie. Did you know that chronic constipation is one of the leading causes of pelvic floor dysfunction? Most people think straining to have a bowel movement is just uncomfortable and annoying. But what's happening inside your body every single time you strain is far more serious than most people realize. Today, we're going to talk about something that nobody wants to discuss, but absolutely everybody needs to hear. According to the NIH, chronic constipation affects approximately 9% to 27% of the population worldwide, with higher prevalence in women and older adults. Up to 30% of children suffer from constipation as well, and almost 1 in 20 visits to the pediatrician is due to constipation issues. Before we get into the issue of constipation, let's discuss what is considered normal when it comes to bowel movements. Normal frequency can be anywhere from 3 times a day to 3 times per week. The consistency should be formed, but soft, long and soft, about 4 to 8 inches in length, not hard balls. And the color can be anywhere from light to dark brown. The width should be about that of a banana. A person is suffering from constipation if they have fewer than 3 bowel movements a week, have stools that are hard, dry, or lumpy, have stools that are difficult or painful to pass, or have a feeling that not all the stool has passed. Constipation is not a disease, but maybe a symptom of another medical problem. So to keep it simple, I'm going to kind of talk about 3 types of constipation. There are many more. The first is slow transit, which is due to slow or delayed movement through the colon, which pushes the food along toward the rectum. The second is normal transit, which means that the colon functions normally, but the body has trouble expelling the stool. And the third, which can be related to number 2, no pun intended, is outlet constipation, and that results from pelvic floor dysfunction, where the muscles that support the bowel movements do not work properly and potentially don't relax to let the stool out. So what are the factors that can affect the quality and the quantity of bowel movements? Dietary factors, such as not getting enough fiber and not drinking enough fluids throughout the day, are major contributors. It is generally recommended that men eat 35 grams of fiber per day and women 25 grams of fiber per day. But most people eat less than half this amount, reaching only about 12 to 18 grams per day. For children, you could check reputable websites or ask their pediatrician what the recommended fiber intake should be for their age. Also, you want to make sure not to increase the fiber without increasing the fluid intake, as that can potentially make constipation worse. Increasing fluid intake helps alleviate constipation as it helps soften stools, promotes regular bowel movements, and supports overall digestive health. Also, it's important to increase fiber slowly. Adding too much fiber too quickly can result in gas, diarrhea, cramping, and bloating. So, when you start adding fiber, increase it slowly over a period of weeks. And how much fluid should we be drinking? Most adults should aim to drink between 8 and 12 cups of water a day, which is about 2 to 3 liters. And this is to stay hydrated as well as to support digestive health. The amount of fluid that kids need vary by age. So if you're interested, you could look up fluid intake charts online. Remember, fluid intake doesn't just come from what you drink, but it also includes fluids that we get from food sources, like fruits and vegetables. Another factor that we don't always have control over that can lead to constipation is the medications we take. For example, pain meds or opioids. Anyone who's had surgery and was prescribed painkillers following surgery can attest to how difficult it makes pooping when you're taking these meds. Often, when prescribing painkillers, doctors will also recommend stool softeners to reduce the incidence of constipation or the need to strain. People who have underlying medical conditions like IBS or neurological conditions, and I'm going to list a few: stroke, MS, spinal cord injuries, Parkinson's. People who suffer with these underlying conditions can suffer from constipation. Another potential contributor are structural abnormalities. And by this, I mean tumors or strictures that cause narrowing of the passage through which the stool flows and can make emptying a challenge. And finally, pelvic floor problems, such as maybe there's too weak to push the stool out, or their pelvic floor muscles struggle to relax, which can also contribute to constipation. Of course, we can't manage all these factors on our own. Some factors need medical intervention. Some need surgery, medication, or pelvic therapy. But there still is a lot that we can do to improve discomfort or improve things from worsening. As I just mentioned, increasing fluid and fiber intake can help tremendously. What's interesting is the bowel really likes routine. It's typically most active after eating, about 30 minutes after eating. And the most natural time to have a bowel movement is typically 20 to 30 minutes after having a hot drink like a coffee or breakfast. But everyone's different. So each individual will need to figure out when is the best time for them. If you're trying to normalize bowel movements, here's what to do. About 20 to 30 minutes after a meal, try sitting on the toilet for about 10 minutes. If after 10 minutes nothing happens, don't stay there. Get up, move. You shouldn't sit long on the toilet because prolonged toilet sitting can strain your pelvic floor muscles. It could increase pressure on rectal veins and lead to hemorrhoids, rectal prolapse, or other complications. Believe it or not, digestion actually really begins in the mouth. So chewing your food really well can be the first step that plays a critical role in breaking down our food into smaller, more manageable pieces. If your food is not well chewed, the pieces will be large. And when they reach the stomach, that can delay gastric emptying. It may make nutrient absorption less effective and will definitely increase the risk of constipation. So slow down and make sure to choose your food. That is really the easiest thing anyone can do. Remember, never strain to have a bowel movement. Straining or pushing places a lot of pressure on the pelvic floor muscles, and that downward pressure weakens our muscles. Weak muscles will compensate. They're going to get tight, trying to hold everything in because they don't have the strength. But tight pelvic floor muscles often contribute to pain. And since tight muscles are not strong muscles, it becomes a vicious cycle of pelvic floor weakness, tightness, pain, and it keeps going. And the outcome can be urinary and fecal incontinence or leakage of urine and stool. Also, with chronic straining, people could develop hemorrhoids, which I mentioned earlier, in the rectum or anus, which can be painful, and people can develop pelvic organ prolapse. And that can happen because the support structures are no longer strong enough to hold the organs where they need to be. So a pelvic organ prolapse is a condition where the organs, the vagina, the uterus, the bladder, the rectum, can start to kind of sag down or kind of move into the area where other organs belong, and they could even drop outside of the body. So how you toilet matters. Ideally, people should sit with their knees higher than their hips. So they need to place something under their feet to get into that position. Not everyone has heard of a squatty potty. It was popularized on Shark Tank, but you could use anything under your feet, whether it's a step stool, books, or even yoga blocks. When your knees are higher than your hips, it allows for better relaxation of the pelvic floor muscles and reduces the need to strain by placing your organs in a more optimal position for emptying. What people don't realize is that it can and should be used not just for pooping, but also for peeing. The pelvic floor muscles that control the outflow of urine and poop are really the same muscles, just different openings. So a squatty potty or a step stool can be used for toileting for both pee and poo. A lot of my patients come in, they think it's just for pooping, are always surprised to hear, no, use it for peeing too. It really helps with the flow of urine. So to keep going, when your feet are elevated, you should rest your forearms on your thighs so you're in a forward bent position, and do belly breathing or 360-degree breathing. And that will allow for even better muscle relaxation of your pelvic floor. Remember, you don't want to strain. So if you're in this position, you're doing your breath work and you're still struggling, some other tips include vocalizing. Humming, for example. Humming can help with bowel movements by stimulating the vagus nerve, which promotes relaxation and also improves gut motility. Often what pelvic therapists tell kids is moo to poo. It's getting the use of that vocalization to get the pelvic floor muscles to better relax. Another technique is called belly big, belly hard. And it's a pelvic floor friendly pushing method, and it's designed to help with bowel movements. And it coordinates abdominal breathing with pelvic floor relaxation. So this is how you do it. You want to inhale deeply through your nose, allowing your abdomen to expand naturally. So your belly will fill with air. Then, as you exhale, you're going to gently tighten your abdominal muscles and keep your belly inflated. This creates gentle, controlled pressure without holding your breath or straining. And while you exhale, visualize or focus on gently bulging your pelvic floor muscles. This will help lengthen and relax the pelvic floor muscles, opening the pelvic outlet so stool can pass more easily. Also, regular movement such as walking or light exercise stimulates bowel activity and reduces constipation, so daily exercise is super helpful. A lot of people don't realize that stress could affect bowel function. So incorporate breathing exercises, mindfulness, meditation, gentle abdominal massage into your routine, as it's a great way to relax the pelvic floor and support bowel movements. When it comes to diet, try and limit processed foods, caffeine, and alcohol. Processed foods are often low in fiber, high in fat and sodium, while caffeine and alcohol, they dehydrate the body. And all these things can slow digestion and worsen constipation because they make stools harder to pass. And lastly, this is a big tip. Try not to ignore the urge to poop. When you ignore the urge, it sits in the rectum longer. More water is absorbed from that stool for cellular function throughout the body. And as water is absorbed, the stool gets harder, which in turn makes it more difficult to empty when you finally do go to the bathroom. So sometimes we tell people ignore the urge to pee, especially when they've got urgency, but we never want anyone to ignore the urge to poop. Ignoring the urge to poop could also dampen the signals or dull the rectal nerve sensitivity and weaken pelvic floor muscles, which contribute to chronic constipation. So while it's okay to ignore the urge to pee, it's never okay to ignore the urge to poop. So to summarize, by combining these practices, having a consistent routine, proper toileting posture, good hydration, a fiber-rich diet, performing physical activity, and appropriate relaxation techniques, you can maintain healthy bowel function and reduce the risk of constipation or other bowel or pelvic floor related issues. Thank you for joining me. Hopefully you guys learned something helpful today, and we'll see you next time. Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there, because knowledge drives better health.